real patient. Yes, the session will be recorded and it'll be made available to view later. Hello to Brazil. Hello to Zurich. Thank you for greeting in the chat. Please go ahead. It's nice to see where you're all from. So my name is Amanda Bach. I am the Chief Partnership Officer at The Synergist. And The Synergist, for those of you who don't know, we are the behind-the-scenes nonprofit organization that provides the backbone to make this type of collaboration across multi-stakeholder partnerships and spaces possible. And PEOF is one of those joint initiatives, which some of you may know is a joint collaboration between PFMD, UPATI, and EPF. So next slide, please. In this, thank you. In this initiative, we really try to foster collaborative and co-creative ways to make patient engagement, specifically patient engagement, stronger, deeper, and more sustainable. So we work across all stakeholder groups to help achieve this. Next slide. We're therefore delighted that in today's session, again, and as well as in previous PEOF sessions, we have a good balance of multi-stakeholder representation, predominantly patient organizations and patient experts and advocates. It's great to see your interest in this resolution, but we're also joined by friends and colleagues from industry, researchers, healthcare providers, and other sectors. And we're also sharing with you the geographic breakdown. And as you can see, it's heavily Europe and North America, but we're also delighted to welcome those of you that are from Yemen and Mexico and India and Argentina and other countries across the globe. On that note, we are delighted to let you know that as of recently, our virtual PEOFs are available in more than 50 languages. So you can access instant translation. There will be a Wordly app that will show up in the chat or on the upper right hand of your screen. And you can open it and choose your preferred language. And then you can switch between the chat and the Wordly, depending on if you want to make a comment. And my colleagues will put that instruction again in the chat for you, and we'll do it a few times throughout the session so that you can find how to do that. On the next slide, I'd like to introduce you to the Global Patient Movement Catalyst. It's my pleasure to say that it's this group that have put today's session together for you. It is a group that is stewarded by global patient leaders who you probably know and will recognize. You can see their photos on the top right quadrant. This is a volunteer-based coalition of experts and champions on the value of lived experience and how to strengthen these voices in health systems and civil society. It's elegant that we're at a PEOF session today because PMC was born at PEOF 3 years ago. And we're very much a grassroots movement that is still in growth and still in motion.
I'm supposed to be in a meeting, by the way.
Russell, would you mind? Thank you. Nice to see you, by the way. Stay muted. We have identified 3 key pillars that we're concentrating on, which is positioning, funding, and capacity building to help all patient organizations and experts have a more sustainable and stronger presence in civil society, but as well as in health systems. And we see these 3 pillars strongly enshrined in the resolution that was unanimously adopted last spring by the WHO. And so really, today's conversation is about showing how this resolution can be a unique accelerator for all of our work if we know how to harness it. And today, that's hopefully what we will explore doing, how to harness this resolution for our health systems and for our patient outcomes. So in the next slide, briefly, you've seen the agenda. We will have a brief scene setting of about half an hour by our panel. And then we're going to put you all to work and invite you to become interactive for 45 minutes in our breakout sessions using the interactive Miro board you'll be introduced to when you go into your breakout groups. And then we'll all come back again and have discussions as well as wrap up the next steps. These next steps will be shared with you in writing after the session. As I mentioned, this is recorded and you can also review and spread the video, but we will also share key learnings with partners from the WHO and elsewhere to help accelerate the implementation of the resolution. Hello, Maria. If you could mute, that would be great. Thank you. So without further ado, I'd love to introduce you to our panel of expert speakers. So we are joined by Antoine and Vincent Dumais, who have been historic and important partners for patient engagement and participation and partnership out of the University of Montreal in Canada. Antoine bringing a healthcare perspective as well as research academic view, and Vincent bringing a lifelong patient advocate perspective. We also have Danny, who's the CEO of the International Alliance of Patient Organizations. Kira, who is joining us from the WHO and has been instrumental in the creation and birthing of this resolution. So it's fantastic to have the deep insights that she'll bring. And Jennifer Austin, who's the chief executive of what we call Global Skin, because International Alliance of Dermatology Patient Organizations is a long word to say. So with that, and without further ado, I hand the floor over to Kira. Kira, please walk us through this fabulous resolution. The floor is yours.
Yeah, thank you very much, Amanda, and welcome everyone also from my side. It's a real pleasure to be part of our webinar today in order to exchange and explore the different options that we have in order to join forces to implement the resolution. And in my about 10 minutes, I would really like to begin our conversation today by framing the importance of social participation, especially at this pivotal time as a landmark resolution on the topic was passed earlier this year at the World Health Assembly WHA 77. And the core question, I think, for us is how can we ensure that the voices of people, of communities, of patients are truly amplified when it comes to decision-making processes that impact their health and well-being. Next slide, please. Let me start by a brief definition, because I think it's always important we are on the same page when we refer to social participation. And by that, we clearly acknowledge that there are many different terms used in different country contexts, like social participation, public and patient engagement, community participation, empowerment, health democracy, etc. When we refer to social participation, we really look at it from a health systems governance perspective, and we chose social participation as we saw it as the most encompassing term, including people, communities, patients, caregivers, families, etc., in order to ensure that the voices are clearly heard in terms of their views, demands, needs, ultimately in order to render policies, strategies, and plans more responsive to their needs. Social participation, as it is defined by WHO, means empowering people and communities through inclusive participation in decision-making processes that affect health across the policy cycle. So this can really happen at the national, at the subnational, and at the local level, and across the policy cycle. And let me be clear here that we really mean from the stage of priority setting to policy development, implementation, and monitoring and evaluation. So we may think about public hearings during the process of drafting laws, a participatory public and patient engagement process in order to feed into specific health strategies and plans, or community and patient representative at hospital boards. What is important in terms of the characteristics is really that we are talking about a two-way dialogue, this back and forth instead of one-way communication. It's about creating safe and constructive spaces by which power imbalances are mitigated and conflict of interest are addressed. And it's really about ensuring the inclusive participation and valuing the lived experiences of patients and how we can counter in order to better respond to the needs in their daily challenges as well as making, and I think that's important, these participatory processes more regular and sustained over time. Next slide. Now, why is it important to talk about social participation? Above all, it is a fundamental component of the right to health and reflected in the right to participation. Let me give you three main reasons. First of all, social participation is a key component of the primary healthcare approach. You can see here the diagram with the three components, one of them being empowered people and communities, because it promotes the equitable progress towards universal health coverage by amplifying people's voices, in particular those of marginalized and vulnerable groups, to influence decisions so that these policies are more responsive to population needs. It very much goes into the direction of co-ownership, co-creation, and greater acceptance of decisions, which lead to broader implementation. Secondly, social participation also helps to foster trust. I think we have all seen this in the COVID-19 pandemic. It has demonstrated the absolute need to engage with people, community, patient groups, etc., to better understand their daily challenges. But we also understood that trust is not something that is built over time, overnight. It requires time in order to build those trustful relationship, and investing in participatory processes in advance helps in order to then leverage them in terms of a new pandemic or emergency. And lastly, social participation also advances the key principles of health systems accountability and transparency, and allows for the policy adaptation through feedback triggered by regular engagement methods. Next slide, please. In 2021 now, a couple of years back, WHO published the Handbook on Social Participation. You can see the cover on the left hand of your screen. And I invite you, of course, to peruse through the handbook as you see fit. And it was really a collective effort across many years to bring in and develop practical guidance. You can find 9 country case studies across the WHO regions that really has informed the recommendations that have been put forward. The handbook is very much targeted towards member states. You can see it here in this green box on the screen, in order to provide guidance on how best to engage. And here the engagement modalities might be through direct population engagement, through communities, and here especially recognizing the large history of community responses, especially in disease-specific programs, etc., and via civil society, in order to then render policies, strategies, and programs more responsive to their needs in steering the health sector towards the novel goal of universal health coverage by leaving no one behind. On the next slide, then, you can see the chapter topics, actually, and these are reflecting the key issues for policymakers to reflect on when setting up strengthening institutionalized social participation. First of all, by understanding that participation is a core instrument for voice, agency, and empowerment. We are aware there are various participatory mechanisms out there. There is not that blueprint available. It's about that mix of mechanisms that is useful in order to hear from broad and varied voices across society. The second one is about the enabling environment, and here very much acknowledging that we have power dynamics that exist and that are ingrained in a country's political, social, and economic landscape. And these power dynamics create unequal conditions for participation, as they pose structural barriers to participation for some parts of the population who have usually less voice and agencies, and inadvertently increase access to decision-making processes or structures for others who already hold power and influence. So it's really, when we talk about meaningful participation, it's about evening out the playing field within the participatory space as far as possible. And what we mean by that is counterbalancing the inherent and ingrained power imbalance that exists in every society for purposes of that participatory space. And first of all, that means acknowledging that these exist, and then finding strategies through format and design and capacity building on how to mitigate those power dynamics. And starting with the other chapters, for example, on representation, who is participating, who is not participating, and subsequently reaching out to those often marginalized and vulnerable population groups who do not have or who are not adequately heard in decision-making processes. Afterwards, the importance of capacities. When we talk about capacity building, it is both for civil society, communities, patient organization, but also capacity buildings for government actors when they are tasked in order to represent or organize participatory processes. And here we categorize it between recognition, the understanding actually of the added value of social participation for their policy work, the technical skills on how to actually do participatory process, and the communication on how it is being translated of these different options. Other issues will be around population engagement and decision-making processes. We are very much aware that there are a lot of participatory processes happening, but there's a huge gap between whether these results that are coming out of these participatory processes are adequately taken into account when it comes to the decision-making process. Another aspect in terms of legal frameworks for participation that can be helpful in order to institutionalize and again linked to the last topic is how to think through actually how ad hoc engagement that we have again seen a lot in the COVID-19 pandemic can actually then be converted and embedded within regular and sustained engagement over time. On the next slide, I want to briefly reflect, and this is a full slide. I won't go into the all details, but it is a fundamental and a critical time at the moment that we are coming together because of the large participatory process actually leading towards the resolution that has been adopted at this year's WHA at the World Health Assembly. What I want to mention is that there has been a lot of lead up towards it. There had been different regional committee resolutions which may focus on primary healthcare as an approach, on the importance of health equity, on resilience, etc., where social participation has been featured as a key important point in order to move forward. The next slide, we can see the 6 member states that have put forward and pursued the resolution led by Slovenia and Thailand. And this core group of member states is continuing to be active and is keen in order to implement the resolution. And importantly, I think a message to all of us is that even during the resolution process, they have voluntarily reached out to civil society groups in order to also understand some of their priorities, and they are doing so in even more so in terms of implementing the resolution. In the next 2 slides, and I will just briefly mention some of those, you can see here actually the operational paragraphs for those maybe not too familiar. These resolution texts usually have the 2 important parts. The first one on the operational paragraphs urges member states to take action. What we can see here is that social participation is very much seen as a cross-cutting governance agenda. When we are talking about supporting member states, it is very much in terms of strengthening their public sector capacities and civil society capacity to meaningfully engage. Secondly, to enable equitable, diverse, and inclusive participation with a particular focus on promoting the voices of all those in vulnerable and marginalized situations. Thirdly, striving to ensure that social participation influences transparent decision-making for health across the policy cycle. Fourth, the implementation and the sustaining regular and transparent social participation, again, by choosing the different mix of mechanisms in order to reach varied and broad voices. Fifth, on the allocation of adequate and sustainable public sector resources in order to ensure that these participatory spaces have the capacity in terms of human resources, but also on the financing part to guarantee that these can be taken forward. The 6th point is on the facilitation of the capacity strengthening also for civil society groups, including, of course, patient organization in order to fulfill their representational roles. And lastly, the recognition that there is also need to support research and piloting various programs, including on the monitoring on how we can actually measure social participation. The next slide is looking towards WHO and how we can help member states as our preliminary mandate, but again, very much acknowledging that different forces need to come together, different actors, including civil society, patient organization, in order to, I think, jointly promote the importance of social participation moving forward, as it is a key component within the primary healthcare approach towards achieving the goals of universal health coverage, of health security, and the health-related sustainable development goals. We will certainly from WHO side continue to develop technical guidance and operational tools. There's an interest to document, publish, disseminate different country experiences to also share and facilitate the knowledge moving forward, and also on the harmonization across the organization from headquarters, regional and country office moving forward, and then the administrative process or requirement to report back to WHA every 2 years. On the next slide, which I will leave you with, and maybe also a call for those who are interested, one of the priority next step for us is together with member states and some already civil society groups to facilitate a multi-stakeholder social participation network, which is properly hosted with UAT 2030. It's very much about facilitating the evidence-informed learning experiences and knowledge exchange, advocating, as we have just mentioned, on the political commitment, not letting it down, but enforcing this in order for the implementation of the resolution to take place, and the collaboration and the consultation on different technical products and tools moving forward, as well as the contribution. And in my last words, maybe also, we hope that this will be set up very soon, and are looking forward, of course, to many of you joining this network in order to share your experiences and for us to work together in order to think through how we can amplify the best the voices of different constituencies, including patient groups, patient organization, people living with lived experiences, so we can render policies and strategies, programs, how services are being delivered more closer to how the needs are in this regard. So with that, I thank you very much, Amanda, and I give it back to you, and I'm very much looking forward to our discussion during this webinar. Thank you.
Thank you so much, Kira. And unfortunately, guys, we don't have time for questions right now, but our speakers will be staying with us, and they'll be in the breakouts as well as in the plenary when we come back. So please pop in any questions that you have into the chat or hold them until later. And with that, it's my pleasure to introduce a close friend and great champion of our community, Antoine, next. And Antoine, the floor is yours.
Hello, hello. 1, 2, testing. Konnichiwa,
Yes,
bonjour, hello. I am connecting with you from Japan, while Vincent is somewhere between Spain and Canada. The two of us started 10 years ago as a patient-physician partnership, and now we've turned into an intercontinental health partnership. What we would like to talk to you about is how to build partnership spaces, which we see as key foundation to implement social participation in health. If you can move to the next slide, please, and the other after. When we think of health systems, we think of them, health systems are like triangles. They are top-down, they're professionally driven, they're industrial systems that are aimed at delivering services, drugs, tests, technologies, and short-term interventions to patients who are viewed oftentimes by the systems as clients, users, beneficiaries, or customers, and performance is measured in numbers and speed and reduced cost. This is where most of our healthcare resources and money are invested around the world. If you can move to the next slide. This is a circle. This is the circle of people and communities where care circulates across life cycles, across generation, where health is created in the food that we eat, the information we share, the caring relationship we nurture, and the air that we breathe. Communities, there are systems of friendship, of solidarity, of reciprocity. These are organic, natural systems where knowledge is largely tacit and the rules are often left unspoken. It's connected with nature, education, social policies. This is where over 95% of care is given across the world and where 80% of health is created. Next slide. So what we need, and this is why social participation matters, is to connect these two worlds. Partnership spaces, which we're talking to you about, is the connection between health systems and communities and people and patients. These are in-between spaces where we hold necessary dialogue between people, communities, and health system. And this is where we need to create cooperation and synergy between these two different and necessary worlds to create health together. Next. So the WHO resolution for us is important because government around the world have committed to strengthen this bridge between communities and health systems, to recognize it not just as a nice thing to do, but as a core function of health system, to design it with the knowledge and experience of people and communities around the world, and to fund and sustain it with public money. Patients matter in creating this bridge because patients navigate across these two worlds throughout their lives. Patients experience health and illness across healthcare services, in clinics and hospitals and pharmacies and psychosocial services, but also in their communities, at school, in their family, in the workplace, in their neighborhood, and in their civic life. So if we're interested in creating health for all, we ought to be interested in reinforcing this connection between communities and health systems. And if we want to build this bridge, we need to partner with patients. Speaking of patients, my dear friend Vincent, what should a partnership space look like?
Thank you.
And how should we play in this place?
Yeah, thank you very much, Antoine. So like you were just saying, I think this shared partnership space should be co-built, actually, should be a collaborative space where we co-build a vision of what it means to collaborate, strategies also, and eventually it's the space also where we can lead together the transformation which come with the vision and strategies. So when I say we, obviously I mean institution, but what I would call the patient ecosystem. And the patient ecosystem, and Kira told a little bit about it. It's about people living with experience first, and eventually their representatives. And I think it's very important to assess from the start that we are people living with people with experience. We are unavoidable in this journey for different reasons. The first reason is because we have a unique perspective and therefore a unique knowledge of health systems in which we navigate so much, sometimes in harmony and sometimes in chaos. But we are constantly in relation with both systems, and so we are always trying to partner with them in many different ways, at the micro level, at the meso level, at the macro level. Without exaggerating, we can say that everything starts with us and ends with us. And many times it's well known now that when we effectively partner and inside with the system, we are helping to burst silos. We are giving meaning to action and orientation. We are helping to reframe what is crucial. The added value of our engagement is well known now and is also validated by science. So that's why I think we can easily is our DNA. So when part of this partnership, that's what we'll bring naturally. We will bring social participation. We will lead social participation. That's what we do on a day-to-day basis to heal, to survive, to plea for the best care possible. It's critical at that stage that we understand exactly the role and the role that patient partners and patient organization should play at this stage again of the process. Next slide, please. Oh, sorry, I didn't say that. Okay, the next one, please. The next one. And that's exactly no, the one before, please. So in this sharing space, that's where we will partner, where we will build a vision of what is collaboration, what is partnership, how we work together. It will be an amazing opportunity to build bridges between our perspective and visions. That's what the resolution is offering to us, this great opportunity of building bridge between our different perspective and visions, to work in partnership to define and drive transformation. And eventually, and that's why we're going back in the circle and in the triangle, help our peers and organization to move also in this direction. So we are facing a big cultural change that will take time, but we need to be all together in this boat in order to make it happen. Thank you.
Thank you so much, Vincent and Antoine. So moving from the partnership perspective to a patient organization and what do we do with all of that expertise perspective, it's a pleasure to hand the floor jointly to Danny and to Jennifer. And I have actually been asked if maybe we could stop sharing slides so that we can see each other for a little while. So perhaps we could do that as well. And Danny, I offer you the floor.
Thank you, Amanda. It's a big, big pleasure to be here today and continue the conversation that we started back in May this year, where we held a side event at the 77th World Health Assembly. We were talking about the role of patient organizations in universal health coverage and also about this key resolution that was being voted at the assembly. And I truly believe this resolution marks a game-changing moment for our patient organization community. It's an opportunity to fast track, but also to strengthen the work that we have been doing on the ground for years, bringing the patient perspective to law, policies, and services. We've been there. We've been members of health ministry advisory committees, health budgeting processes. We're co-designing services, and this is all social participation. But this resolution is also a very powerful opportunity for us to come together. Advancing social participation requires ongoing collaboration, resources, strong advocacy, continuous training. All this is at the core of what IAPL does and was also a big reason why we joined the patient movement Catalyst that Amanda just talked about. And why I think this resolution can work for 3 reasons. First, social participation is being institutionalized. Never, ever before social participation was put as an obligation for governments like this. As a non-state actor in official relations with the WHO, we've seen previous resolutions that mentioned the essential element of having patient engagement or social engagement to advance a health agenda. But this time, is different. This is social participation is put as a mandatory component of health systems. So governments have the obligation to do it. Second, the focus on accountability. Governments will have to track and evaluate how they are engaging people, communities, and civil society. And by making this a core part of health systems and how they are evaluated, I think this resolution can help us shape systems that truly listen to and respond to the needs of those they represent, and do this on a continuous and systematic way. And third, which is in our favor, I think this resolution is well aligned with the global efforts toward universal health coverage by 2030. And I think the awareness and recognition of how one agenda supports the other can really accelerate the process and the commitment from governments to institutionalize social participation. Any red flags? Always. This is a huge move, but I'll focus on 2. One, it's key. Institutionalizing social participation cannot be a static process. It must allow flexibility, adaptation, adjustments to reflect the dynamic nature of societies and health systems. And we need to be ready to respond to changes in populations, governments, economies, and conflicts. And also, we cannot miss the opportunity to include the process, those populations that are historically marginalized or underrepresented in health decisions. So what can we do as patient organizations to seize the window of opportunity that this resolution created and help translate this into practice? At the global level, IAPL is there and will continue to inform the patient community about updates on the implementation of the resolution, how they can play an active role in this and support them along the way. But on the ground, in their countries, patient organizations can do and are doing a lot and continue to collaborate with each other and civil society as a whole. Have a unified voice when interacting with the government and remember to include those who are not usually part of the decisions. Have a clear plan when interacting with the government. What does successful social participation mean to patient organizations in your country, in your context? What are you doing that can be used as a reference? Share your stories, your needs, your successes, and ask your governments what they are planning to integrate social participation in the country. Be there, holding them accountable. And before I finish, I just wanted to share that next month, on the 11th of December, our patient organization community will have access to a tool, and I think it's going to be a very useful one, that was built upon this social participation resolution and also the overall movement towards universal health coverage. I'm talking about the UHC Compass. It's a tool that was created to help patient organizations to advance UHC, universal health coverage, on the ground. And among many features, it has the goal to build the capabilities of patient organizations to engage with governments and play an active role in decision-making processes. This tool was developed by a group of patient organizations, the Global Patient Think Tank. IAPO is one of the members of this group, and we are proudly hosting this tool. Next month, we'll be sharing more news on that, and I hope you can join us in the launch of this tool. And just to sum up and share the floor with Jennifer, yes, I'm very confident that we are heading in the right direction with this resolution. I feel that more than ever, it's time for us to get together as a global patient community, unite and move forward together so we don't lose momentum. Thank you so much.
Well, thanks, Danny, for all those inspiring remarks. What I just want to add today is to speak a bit as actually a member of IAPO, but also as an umbrella organization that represents over 280 patient organizations in 70 countries. And just the experience of our community, I think that we've gone through the fact that organizations like ours, many of you on this webinar today, are already very involved in social participation. And so I don't need to list all the ways that you're doing that. The important aspect of what patient organizations bring to this social participation is that we speak for the many, and are often very professional organizations that are weighing the needs of all of our patients. So this is a voice that's incredibly important to be bringing to the table. And for us to be able to do our jobs, I look at it as a three-leg stool. So there's three things that we need. We need a seat at the table, we need to have skills, and we need to have resources. And this resolution has actually given us a very meaningful seat at the table. So this is the first leg of the stool. And this has been one that has been very difficult to break through on for many organizations. I know myself working for an organization that's actually pursuing a resolution for the World Health Assembly next year. It's very challenging to be able to navigate that environment. I know for our patient organizations at their national levels, trying to navigate through healthcare systems to understand where they can have a meaningful impact has been very challenging. I believe that this resolution will really change that. It's going to give us a roadmap. It's going to give us entry through the door that we've been knocking on. So this launching pad that didn't exist before, it really is clear that the member states that passed this, that promoted and passed this resolution, heard the deepest aspirations of our communities, that we want to be part of the dialogue and we want to lead and be part of leadership in decision making. I think it's important to note that in the resolution, there is mention of the fact that there's a need to strengthen the capacities to meaningfully engage, finance their participation, and to ensure that we're addressing power imbalances. And I think that Kira spoke to some of this before. So I just want to point out some of those challenges, but also some of those solutions from a patient organization perspective. So really, it's around the two legs of that stool, the skills and the resources. And, you know, that we've had this olive branch extended to us by the WHO and the member states to have the seat at the table. We need to now meet them halfway or even more than halfway. But the way that we need to do that is to boost our skills and to find more resources. So that's important for us to be able to seize this opportunity. And I think one of the big challenges, though, is that we have a wide spectrum of experience and capability within the patient organization community globally. We are talking about countries that are low to middle income or lower middle income countries. We have organizations that are run by volunteers. This is extremely common where they do not have any money to hire people to do the job. So these are people doing this at night while they do their day jobs. They often don't have any experience doing advocacy work. And so there is a big step function that needs to happen for many of these organizations. The other aspect I think that we need to really think about is diversity, equity, inclusion, and belonging. And we have to give a boost to organizations that are not typically heard from, representing communities where the patients don't have a voice. And we need to remember that equity is not the same as equality. It's something that we have to be very attuned to. And I know in our organization, we're looking at ways to do things differently for those that are not able to participate in the ways that perhaps I might be able to, being in a country like Canada. So we have to do what we can to bring everyone along with us. I think that umbrella organizations like IAPO, like Global Skin, can be extremely helpful to organizations in building their capacity. And that includes building their skills, their experience, their connections, and helping them to find resources. I think as a global community, we all have a role that we can play in mentoring each other and helping to support each other so we can lift up the community as a whole. We are a movement. We're not just the individual organizations that we are a collective voice. I think something that we can all think about, no matter how big or small our organizations are, is to join coalitions and campaigns, get involved with the UHC campaigns, join an organization like IAPO. I know our organization is deeply involved with organizations like RDI and NCDA. There are so many groups that are out there that are doing big picture thinking on the kinds of issues that matter to you and your patients. And so I think that that's a great avenue for us to be pursuing together. But I think we do need to reach down and lift up those that are having more challenges than we are having. And there are so many groups like that, but that can have such a powerful impact if they're given the tools and resources that they need. And so finally, I think that another key way that we can be helping to build this this powerful movement of patient organizations is to become part of the Global Patient Movement Catalyst, which we've heard about a few times during this webinar. I'm one of the stewards that is working on this project. I feel passionately about this movement because I think together we can take on many of these challenges and we can take that rightful seat at the table and have the meaningful impact that we need to have for our patients. So thank you so much for being here today and being prepared to work in the workshop on how we can take this opportunity and make the absolute most of it.
Thank you so much, Danny and Jennifer. For those of you that maybe have missed it, I've put in the link again to the Global Patient Movement Catalyst and how to sign up and join us. It's lovely to see many of your faces, finally. Really wonderful. Okay, so next, what we're going to do is we're going to break out into groups. You're going to be automatically put into groups. You will be given a facilitator whose task it is to keep you to time and frame your discussions broadly. But you will all have an expert, a subject expert with you in the room as well to help answer any questions and lead the conversation. Once you're in the room, you'll be given a link to a Miro board. There will be instructions there as well. There will be the resolution, a BMJ editorial that some of us wrote, and your facilitator will direct you to your group. You'll have a number and a color. What we would like you to do there is please answer 3 questions. You will be able to capture your answers on Post-its that you can move around on the board. And when you come back after 45 minutes, we are going to ask one rapporteur, who cannot be the facilitator, so please choose a rapporteur from amongst you, to share one example of what a great partnership does or could look like, how the resolution might help achieve or strengthen this, and what actions you think should be taken by which stakeholders to achieve this. And this will inform some of the action points and takeaways that we will report to you after the session closes. So with that, I will see some of you in a breakout with me, and I wish you all very fruitful discussions. See you on the other side.